Is this what you do when someone runs a fever? Cover the person head to toe with a thick blanket. Make the room warm and stuffy? If yes, then this is not the right way to handle a fever. Today, we will learn how to administer first aid in case of a fever. Our topic for today: first aid for fever. When the body temperature rises above normal, we have fever. Our normal body temperature is around 98.6 degrees Fahrenheit, that is, around 37 degrees Celsius. When the temperature rises above this, it is called a fever. It is important to understand that fever in itself is not a disease, but a symptom. Fever indicates that there is some infection that the body is trying to ward off. These are the symptoms that indicate a fever. The body feels hot. The face is flushed. Headache or body ache. So what is the first aid in case of a fever? First and foremost, check the temperature with the help of a clinical thermometer. Temperature can be measured in 2 units, Fahrenheit and Celsius. But degree Fahrenheit is the unit normally used for body temperature. While using a mercury thermometer for a child, it may be placed in the armpit. For an adult, it may be placed under the tongue. You may learn how to use the thermometer by watching the video How to Measure Temperature. A person with a fever above 100 degrees Fahrenheit needs to rest. Check for other symptoms. Find out if the person has any discomfort. Make the person lie down. Remove any thick or extra clothing. If needed, cover with a thin sheet. Loose and comfortable cotton garments are most suitable. Keep the room well ventilated. Take some tap water in a bowl. You may add a little salt to this water. Soak a cloth in this and apply a cool compress to the forehead. If the fever is high, you may wet a towel and sponge the entire body. This makes the patient feel better. Continue giving the person fluids and light meals. Keep the patient hydrated with water, tea, lentil soup, buttermilk, or fruit juice. Consult a doctor and give the person the prescribed medicine in the right dose at the right time. It is important to give the medicine at the correct time intervals as prescribed. Note down the details of fever and medication systematically. This information helps the doctor in treating the patient. Never give any medicine without consulting a doctor. It is important to know when to visit a doctor or hospital for a fever. For an infant less than 3 months, any fever, irrespective of any symptoms, should be checked by a doctor at the earliest. For an older child, a fever above 100 degrees Fahrenheit needs to be medically examined. If an adult has a fever that is 102 degrees Fahrenheit or higher, or the person has fever for more than 3 days, then the person needs to be taken to a doctor. In case of any worrying symptoms with fever, do not wait for 3 days to go to a doctor. Always remember, first aid is meant for immediate help. The patient needs to be examined by a doctor. Keeping this in mind, let's watch First Aid for Fever One more time. Let the person rest. The patient may sit or lie down. Check the temperature with a thermometer. Remove heavy or excessive clothing. Change into loose, comfortable clothing. Keep the room well ventilated. Do not cover the patient with a blanket or thick sheet. Do not cover the head. Add salt to tap water and apply a cold compress to the forehead. Sponge the entire body with a wet towel. Keep giving the patient fluids and light meals. Keep an eye on the patient's condition and visit the doctor if required. Your question for the day. Speak to your elders, doctors or nurses to seek information on diseases that cause a fever. Make a list of these diseases and learn about them. Learn first aid. Stay alert, stay safe.